What's up, guys? Justin Brock here, and was just talking to an agent, and it got me thinking that I needed to just do a video about how Medicare Advantage commissions really work. All right, guys, so Medicare Advantage commissions, you have your standardized, obvious Medicare Advantage commission that people talk about, and that is your CMS approved amount. Looks like that's $600 for a true up, $300 renewal, or $300 for a non-true up $300 renewal. That is the core street level Medicare Advantage commission for anyone who is paid direct by the carrier or is put at that legitimate street level. That is the maximum that a carrier is allowed to pay the agent for the sale. It's the standardized amount they're allowed to pay the agent for the sale of a Medicare Advantage plan. That is not all the Medicare Advantage carrier or company or plan sponsor, whatever you want to call them, is willing to pay to acquire the business. So they're able to spend money on marketing, right? They're able to spend money on administrative costs. And so what they do is for work with FMOs or large marketing groups, IMOs, NMOs, whatever, is they create an additional amount of money that is called administrative fee. And this administrative fee is typically divided up amongst the people in the hierarchy, or sometimes it's passed directly on from the hierarchy to the agent or agency owner. Let's say that an agent is writing some policies and he's at 5 policies, 5 Medicare Advantage plans a month. He's probably at street. Then you have someone above him who represents 10 agents, and they're all writing 5 a month, and that person may be getting $50 and $25 renewal administrative fee. But the concept is they can divide that up however they want. Some carriers have the ability to build an agent into the hierarchy where the carrier pays some of that. Some carriers do not. Some carriers assign it all to the top of hierarchy, the person that has that direct contract. Those carriers like Humana, WellCare, but the carriers that will allow you to divide it up amongst the agents paid direct are like Aetna, United Healthcare, right? Now, if you are not a huge producer, this may not be, a very big deal to you. You may not be warranting any of this administrative fee override. However, as you get bigger, it's good to know what's out there so you can know what to expect from the people that are profiting off of your efforts, right? And also there's some give and take. Sometimes these FMOs are doing a lot, helping you, subsidizing in some other way your cost, and they're using that money to pay for that. But other times, they're taking all of it and they're not giving anything. So it's good to know. Now, the top of that administrative fee is different depending on carriers. But just for the easiness of understanding it, we're looking at roughly a $200 if it's new to a carrier, first year administrative fee, and then a $100 renewal. That's typically the top. Now, some of them we've seen it, $300, $150, especially with like some local carriers, things, people that are willing to spend a little more to acquire that business. And then we've seen some of the big carriers even be at like $120 renewal or $130 renewal and $250 on the first year, something like that. But the easiness of understanding it, say expect that they're at least at $200 first year, $100 renewal, right? That's the administrative fee. There's also a marketing budget that these carriers have where they will push money into agencies that are producing or FMOs, IMOs that are producing by just giving them money so that they can use that money to market their services or to help their distribution market their services and get out there. Now, that can be huge. Like you could have an NMO or an IMO get millions of dollars at the cusp of AEP based on saying this is how many applications we think we're going to be able to deliver. This is how much marketing support we need. And then that carrier, based on the relationship with them, saying, hey, based on their trajectory, what they did last year, our relationship, our expectation, we can approve that they get $100,000, $500,000, $1 million, $2 million. And those sound like big numbers, but we're talking about groups that are doing significant production. Highest I've ever heard is like $30 million, being one of the largest producing call center entities in the country. I'm not even sure. I didn't see that on paper, but makes sense based on the numbers that I've seen. And, we get marketing money like that as well. Not $30 million. If we did, that would be great, but we'd have to produce to make sure that that was, relevant for our organization. Now, sometimes people talk about, well, what about a CPA deal? Well, CPA deal is where a product or a carrier may say, well, if you write this, we're going to reimburse you marketing costs per acquisition of, an additional $100, $200, $250, $300. I've seen it as high as $425 reimbursement. But sometimes that $425 reimbursement is a combination of an administrative fee and marketing dollar budget. So it's not like there are carriers that are doing all three at the top level. It's some push the money into a CPA style deal. Some do a really high administrative fee. Some do a really good marketing stipend that they give you to help out or give your FMO. And that money's supposed to trickle down based on what you actually can do. It's not supposed to trickle down based on what you think you might do. It's supposed to trickle down based on a little bit of what you think you might do compared with what you've done in the past. I can't go and just say, here's $50,000, Mr. Agent who's never written any business, because I'm expected to produce for the money that I'm getting. So when I divide it up, I have to put it where I think I should get, 100 applications here, 200 applications here, all that kind of stuff. You can't put a specific mark on it necessarily. Like I can't say, here's $10,000, you need this many applications or you have to give it back. But I can always say, well, I gave that to you and you didn't deliver, so I'm not giving you any more money, right? And that's how most FMOs and IMOs treat it. Some of them we think sit on the money a little bit too much and maybe utilize it as part of their profit margin. But who's to know? Most of the time this is all speculation or hearsay because you're not actually, sitting in that company and going through their actual budget. So Medicare Advantage commissions are a little bit less structured than senior supplemental commissions, Medicare supplement, ancillary, where it's a percentage of premium, and there's street, and then there's all these, MGA levels, FMOs, all this kind of stuff. When you have a group that says this is the MGA level, this is the FMO level, this is the NMO level, and they're talking about all Medicare Advantage carriers, they're just creating some sort of internal rubric that doesn't actually hold weight when put to a test against what the carriers call these levels, because the carriers call them all different things. For instance, with Aetna, the first level is GMO. So you have street level agent, then you have, LMO, then it's GMO, right? But you never hear anybody use those terms. So if they're not using those terms, they're not talking about Aetna. And then, with your United Healthcare, for instance, United Healthcare is going to have a GA, then it's going to have an MGA, then it's going to have an FMO, and then on top of that, the last one is going to be an NMA, which no one even talks about, an NMA. So there's tons of variables in this stuff. It can get pretty complex, and if somebody could sit down and break the whole thing down, but instead of doing that, I just want you to know that that's kind of your pots of money to look at. You have your core commissions that a street level agent would get. You have your administrative override or administrative fees, and then you have a marketing budget that can be used on a CPA basis, but it's normally by some carriers given out in advance. Carriers that will take some of that marketing and really go hyper local on it. We've seen Humana do that. We've seen United Healthcare do that. We've seen Aetna do that. United Healthcare what I'm trying to say, tongue twister. United Healthcare refers to this as FMA dollars, and they'll give 5,000 here, 10,000 here, 15,000 here, depending on what your production is, to help out in local markets. So they have local expansion efforts, whereas Humana is historically more top down. They want to give it to the top level and have it trickle down. Aetna does a little bit of both. United Healthcare can do a little bit of both depending on the group. So there's no one size fits all to this stuff, but the money is split into 3 different ways and going to different places. And if you know it's out there and you're actually producing, which is key, knowing that there's money out there, writing 3 applications and thinking you should get some of that money, you shouldn't. But if you know it's out there and you're really producing, you should know what there is to ask for if you're really, really producing Medicare Advantage business. Also, Medicare Advantage commissions can give Medicare a bad name, or Medicare Advantage a bad name, because of how much money flows through it. But we've written a ton of Medicare supplements, and it's extremely fruitful to write Medicare supplements, especially when you look at the persistency and the lifetime value of each client. I think is higher than it is the Medicare Advantage, especially if you don't factor in the free marketing dollars. So I don't think there shouldn't be any bias towards Medicare Advantage versus MedSup for commission, because they're both extremely fruitful if you look at how to pitch it. The best thing to do is to write what the client is going to be most likely to keep, because if you can't keep a client on the books, none of it matters. It's all a renewal, long-term type of business. And that's all I want to talk about. That's how Medicare Advantage commissions work. Drop a question below. Like, tell me what you're getting, or tell me like a problem you've run into. Tell me if you've had an FMO that didn't explain this kind of stuff to you, or even lied to you about it, like we've seen so many times before. And also let us know if you have been successful in getting any local carrier support, administrative fees, and what carrier is the #1 carrier that you like for support, whether it's money that they're supporting with, or efforts, getting you to events, all that kind of stuff. I want to see what carrier is supporting you the most. United Healthcare, Humana, Aetna, Cigna, any of these carriers, WellCare, Anthem, any local Blue Cross, local carriers, Clover, all those. Any of them you want. Which one's supporting you the most? I think it's an important conversation. Local carrier support. Thank you guys so much. Subscribe to the channel. Talk to you soon.